Thank you so much, Bella. And I'm so pleased that we were able to get at least a few minutes with Nikita from Malawi. Really appreciate the program and excited to shift into the faculty development program. It is my honor to welcome Shanae Lee, a longtime colleague who wears many hats in the National Center for Primary Care. Today, she'll be wearing the Program Manager for the Faculty Development Program hat. Thank you so much, Shanae, and welcome.
Thank you, Megan. Good morning, everybody. Welcome to the National Center for Primary Care's 2022 Faculty Development Graduation Ceremony. Thank you for joining us online to celebrate the accomplishments of this year's Faculty Development Program participants. This is the first virtual graduation in the history of the NCPC Faculty Development Program. I want to thank the NCPC team for helping to make this moment possible for this year's participants. My name is Shanae Lee, the Associate Project Director for the NCPC Faculty Development Modular Program. This program, historically with a target audience of junior faculty within the first 5 years of their appointment, offers 8 modules in areas needed to develop and enhance skills in teaching, scholarship, and leadership. Modules offered have included clinical teaching in small groups, large group teaching, writing a letter to the editor, manuscript writing, career development, curriculum development, research using secondary data, and grant writing with Dr. Shelia McClure. Program sessions are conducted weekly over a period of 9 months. I've had the pleasure of managing this program for the past 4 of the 25 plus years of its existence under the current direction of Dr. Dominic Mack. During this time, I have met some amazing graduates of the program, which consisted of Satcher Health Leadership Fellows, clinicians, family physicians, surgeons, psychiatrists, and other health professionals. Of the approximate 296 graduates over the years, many are now directors of residency programs, medical student clerkships, federally qualified health centers, and national centers. Others have become funded researchers and published authors. COVID has challenged us all to figure out creative and new ways to keep things running. For the past 2 years, the Faculty Development Program has been 100% virtual. Although it has been a challenge to adjust, we are continuing to find ways to improve and advance the program. As the current director and a past graduate of the Faculty Development Program, Dr. Dominic Mack has been committed to providing resources in education to enhance clinical teaching, scholarship, and leadership skills. Under the direction of Dr. Mack, the program will continue to offer workshops and symposiums that will be available to a broader audience. Through his leadership, we take part in accelerating the journey to health equity. As the founding director of the NCPC Faculty Development Program, Dr. George Russ has always been dedicated to the NCPC's mission of strengthening the primary care system through education, research, and training to improve health outcomes. He is here with us today to share the history of the Faculty Development Program. Dr. Russ.
Thanks so much for letting me be here again. You were so gracious with me yesterday. And I guess I'm old enough now to be that guy who does the history session. I came to Morehouse School of Medicine in 1991. That feels a long time ago now. But what's wonderful is to see people even on this call, on this conference, who are now leaders who came through the faculty development program that we started way back when. Faculty development started actually in 1992, and the roots of it were right from the very first year I got to Morehouse. In 1991, the family medicine department had a strategic planning session. They asked me to facilitate that session since I was the new guy and I could be relatively objective. And we talked through all the things we wanted to do in undergraduate medical education, the things we wanted to do to enhance the residency program, maybe thinking about fellowship programs someday. And we had this long conversation about all of those traditional medical education strategies, as well as potentially scholarship in the department. And at that point, the family medicine department had become more white than black. And we were having questions about, sorry, I lost my screen there for a second. We were having questions about, how do we maintain the nurturing, unique environment of a historically black institution when we've got mostly white faculty? And so we were looking at what our options were. At that time, there were maybe, the AAMC reported there were maybe 36 African-American teachers of family medicine in the entire country. At least a third of those were at historically black institutions. So it was pretty obvious we weren't going to be able to steal folks from somebody else's institution. There were 126 medical schools at that time. So understand that less than a third of them had African-American family physicians on their faculty. And so we developed this notion of a farm team. And through the strategic planning process, we actually came to understand that everything we wanted to do as an academic department was rate limited by our ability to have the faculty to lead those programs. We couldn't do good medical student education, we couldn't do good residency education, we couldn't do scholarship if we didn't have faculty who had the skills to do that. And so I had been in the charter class of the Cook County Hospital Faculty Development Program in Chicago, and my mentors helped me put together a grant proposal to HRSA to get funded to start a faculty development program here at Morehouse School of Medicine. Started in the family medicine department, and we reached out to community preceptors because, as I said, we needed to find a farm team. We needed to have individuals who weren't already faculty to think about becoming faculty. And we actually paid people to spend a half a day a week with us, learning skills of how to teach and how to write grants and how to begin to get involved in research. And in that process, met Dr. Dominic Mack, who became the all-star of that charter class, and who just looked like he wasn't having to try hard at all, but produced better work than any of us. And in that charter class, we began to flesh out exactly what we meant by faculty development, helping people go from being excellent clinicians to being excellent clinician teachers, and from being excellent clinician teachers to beginning to be excellent clinician teacher scholars. And over the decades, we've expanded to include the component in partnership with the Satcher Health Leadership Institute, excellent clinician teacher scholar leaders. And we help people to see that writing papers wasn't just about academic career development, but it bought you a ticket into national conversations. That writing peer-reviewed publications, doing research in a rigorous manner, asking an important question and answering it rigorously, could buy you a ticket onto national steering committees or advisory councils, to speaking at national conferences, to wedge our way into the national conversations that were so important and needed to have the Morehouse School of Medicine voice in those. Now, initially, I was a little cautious about offering this to our existing faculty. They'd already been teaching for some years. I didn't want to be the one to say, hey, you need to learn how to teach better. And so we really focused on the community-based preceptors. What happened then was interesting. Two things happened. One is our chairman decided he would model good behavior of lifelong learning by participating in the sessions. And in that first How to Write for the Medical Literature session, he produced that primary caring editorial that JAMA published that I showed you yesterday, called Primary Caring, where he was able to express so many things that were in his heart, and bought himself a ticket into the national conversation. Through that, we started to have other faculty in the department say, hey, how come I don't get to participate? And before you knew it, we were drawing people in, and they wanted to learn the skills of teaching and writing and researching and leading. We actually had one faculty member who had gone through the faculty development program at Duke University. And she came back to us and said, At Duke, I learned a lot about how to do this. They talked at me about how to do this stuff, but you guys are actually doing it and you're coaching people through doing it. Can I come through your program even though I've already been through one? And so that was the model all along, was to coach and teach and have people do projects and just in time learning, get them through to where they wanted to be in terms of expanding both competency, but also confidence. Never having the teacher be the smart person in the room, but helping people to discover their own competencies and to develop those competencies until they were confident to step into that national space. Through that process, we also listened to our learners. One of them said, you know, when I was a medical student, I never had anybody who looked like me who was a professor. And so I never even thought about an academic career path. And so we developed the 4th year academic medicine elective for medical students, just to spend a month trying it on for size. What do academic folks do? How can we begin to practice the skills of teaching and writing and scholarship? We also discovered that after we had graduated 100 folks from the program and we were starting up the National Center for Primary Care, we said, you know, this is really nationally impactful. We started with 35, 36 teachers of family medicine in the whole country. We've graduated 100. You know, maybe we should be thinking about the national impact. And we developed the Executive Faculty Development Program, people coming from around the country to come on campus for 1 week blocks of coached sessions with a project outcome, teaching, writing, researching. And one of the graduates, I mentioned this yesterday, one of the graduates actually said to us in a very bittersweet comment, this is the first time in my, I think, 15 years in academic medicine. She said, this is the first time as a Black woman that I've felt affirmed as an academic physician. So that's what we try to do, create that cultivating, nurturing environment, teach real skills, coach those skills so that you can actually do them when you finish the program, not just have learned about them. And now we see 2nd, 3rd generations. Over time, Ms. Vera Taylor was the program manager for many years, did an outstanding job getting this program up and running. I taught a lot in the early sessions, but again, we cultivated 2nd generation teachers and then 3rd generation teachers so that those who had been through the program were now the teachers in the program. And we always said to teach is to learn twice. And that became a way to master those competencies at a new level. So that's where we are today with wonderful leaders like Dr. Dominic Mack leading the National Center for Primary Care and taking it to levels that I could only have dreamed of when I was there, with all of the others. I won't name names because I'll leave somebody out, but so many people who have been through that program and who are now demonstrating leadership both at Morehouse and throughout our nation. And I'm so proud to have been a part of that and to have learned from all the learners. So thanks for letting me be here with you again today. I believe Dr. Shelia McClure is going to give us what Faculty Development 2.0 looks like now, with a grant writing boot camp that she's involved in leading. And I turn it over to you, Dr. McClure.
Thank you, Dr. Russ. I first would just like to say congratulations to all of the graduates, because I know that this has been a tremendous undertaking and you have completed the course, and you are to be congratulated. And I want to personally thank Dr. Dominic Mack and Ms. Shanae Lee for allowing me to participate in this program in the small part that I do play. I am the Senior Associate Dean for Research Development here at Morehouse School of Medicine and Director of the Office of Research Development. In terms of my impact in the faculty development program, I originally started working with the program in 2017. And initially, I was just providing a few lectures for the course as it relates to grant writing. And Dr. Mack and Ms. Lee trusted me enough to expand my engagement through providing a 12-week course on research project development and proposal writing. Now, this 12-week course is offered twice each year from September to December, and again, February through May. It's offered on Thursdays, and there are two options, 2 to 4 and 5:30 to 7:30. We do the course in person, and certainly we have pivoted to develop a Zoom course. There are didactic sessions that alternate with writing sessions, and it culminates with a mock study section. And I'm not going to go through all of these course topics, but this gives you some ideas of some of the things that we cover: strategies for developing projects, ideation and communication, developing research teams, resources for study conceptualization, design planning, statistical planning, setting timelines, developing 13 points, fail-proof points for writing specific aims pages, project summaries, and then rigor and reproducibility in your research designs. Now, in terms of some of our course outcomes, we've had at least 10 faculty development participants that have completed the course, the 12-week course. 5 of those have submitted grants, and 3 of those grants have been funded. And I just want to impress upon you, this is no small feat, because these are individuals that are, seeing patients and doing service and participating in this 12-week course. We've also had 1 individual complete a manuscript, and in total, investigators have been able to generate almost $3 million in funding as a result of participating in the overall course. And that funding comes from a variety of sources, including Morehouse School of Medicine, NIH, HRSA, private industry, foundations, and philanthropy. Now, we understand that everyone does not have 12 weeks to dedicate to a course, so we also offer additional writing courses, including the City Essentials of Grant Proposal Development, which is an online course that we do both on demand, as well as a moderated session for those individuals that need just a little bit of a push to stay on track in completing those modules. And we also obviously do one-on-one consults because we want people to continue to engage with us even once the course is over. We also offer proposals pre-reviews. And these are reviews mainly of your research plan prior to submitting it to a funding agency. And we offer this to any faculty member that's submitting their first grant proposal or thinking about their first grant proposals, and even those that have submitted proposals and have not had a lot of luck in acquiring extramural funding. Any proposal can get a pre-review upon request, and our office actually pays for those external reviews. Again, in order to be successful, we know that mentorship is key. And we make sure that individuals are aware of the many opportunities at Morehouse School of Medicine for mentorship, whether it be by faculty here or in the National Research Mentoring Network or in the investigator development course of some of the center grants that we have here at Morehouse. In addition, there are a number of collaborative partnerships where investigators can identify mentors and collaborators, including the Georgia Clinical and Translational Science Alliance that we are in with Georgia Tech, Emory, and the University of Georgia. The University of Alabama has several programs that involve a mentorship component for early stage investigators. And the University of Pittsburgh has the Leading Emerging and Diverse Scientists, or LEADS program, which is another partnership in mentorship. we all know that to be successful, we need funding. And so one of the things that we do in the course and outside of the course is assisting investigators in identifying funding opportunity through providing Grant Forward. Grant Forward is a funding database that can be customized for specific research or programmatic interest. And this is a one-stop shop that includes both federal as well as private opportunities, and it's free to our investigators. As I mentioned, it's important, funding is important, so we have a number of pilot project programs that faculty members can avail themselves of. Here at Morehouse School of Medicine, we have a TX pilot project program, which is intended to fund those projects that will help to move the needle in addressing health equity. And there are a number of different pilot project programs that we have through various grants and partnerships. And our role is to make sure that faculty are aware of these opportunities, know when there are technical workshops related to these opportunities, and who our Morehouse School of Medicine contacts are. And obviously, we guide them through the development of applications for these pilot project programs. I included this slide because these are all of the opportunities that come from the Georgia Clinical and Translational Science Alliance, which includes a general pilot project program, those that are focused on topics such as informatics or biostatistics, epidemiology, or research design, as well as some training opportunities for junior faculty through the KL2 program. This gives you a little idea of some of the outcomes from pilot project opportunities. Of the TX projects, so far we've had one graduate of the Faculty Development Program that has a funded TX project. We also have one member of the Faculty Development Program that has gotten a Center on Health Disparities pilot grant. We have some that are currently applied for pilot funding, and those awards are still pending. And this is critically important because this provides that source of funding to generate the preliminary data that is needed to apply for funding from other agencies outside of Morehouse School of Medicine. Now, I know I've told you a lot. There are a lot of resources. But what we try to do is to keep everyone abreast of news and seminars and resources and training opportunities through a weekly e-research update that is published every Monday. So I want to encourage you to continue to look at that e-research update now. Even though you graduated from the course, we want that process to continue, because I know for a fact from participating in the course that there are many of you who have wonderful ideas that we need to get funded and programmed so that we can move the needle in addressing health disparities and move toward health equity. And I will conclude by sharing what those of you who've been in the course have seen 1,000 times probably, which is your checklist, because writing a grant, developing the grant, and then submitting the grant has a lot of nuances. And so what we want to do is we want to assist you in making sure that you feel comfortable as you move through this process. And again, here's my contact information. I know you're graduating from the course, but I hope you will not be strangers and you will continue to connect with me as we move forward. Again, congratulations, and I thank you so much for this opportunity.
Thank you, Dr. Rust and Dr. McClure, for speaking with us today. I would now like to highlight the 2022 participants of the Faculty Development Program. Sure. Okay. Dr. Dale Hardy, Associate Professor, Department of Internal Medicine. Dr. Sarita Mobley, Adjunct Assistant Professor. Dr. Marche Smith, Assistant Professor, Department of Pediatrics. I would like to now recite the teacher's oath. We are all and always students. We are all and always students. We are now and forever teachers, not filling the bucket, but lighting the fire. Inspired students and inspirational teachers, committed to excellence in all that we learn and all that we teach, we will make a difference. In closing, I would like to congratulate our 2022 graduates and wish them well on their next steps. The NCPC Faculty Development Program will commence in September 2022, and we are currently accepting new applicants. If you have an interest or would like to refer someone to the program, please feel free to contact me at the information on the slide or register at the MSM website. Thank you all for joining us today and being a part of the 2022 NCPC Faculty Development Graduation Ceremony. Wishing you all a great day.